Hello and welcome to the Fraser Health Online Cardiac Rehab Education Program. My name is Heidi and I'm a registered nurse working in the program. This introductory presentation is the first of 8 sessions featured online for your learning needs. Presentations do not need to be viewed consecutively, but instead you can pick and choose what best fits your schedule and learning needs. Be sure to view each topic for the most comprehensive understanding of your cardiac condition. So just a brief outline of today's presentation. We're going to start with an overview of the online education program, some heart facts, some exercise facts, bearing in mind that our exercise specialist will be doing an in-depth presentation on this, touch on risk factors as a segue into goal setting. So with the cardiac rehab program, a bit of an overview here. We do have different topics, and again, you don't need to view them sequentially, but we have risk factors that will be presented by our cardiologist, medications for your heart by the pharmacist, nutrition and cholesterol management by our dietitian, exercise by the exercise specialist, and an intimacy after a cardiac event by the registered nurse. Our social worker will present cardiac event in the family, and the occupational therapist will do a talk on stress management, energy, and how to get a good night's sleep. Catch up with my slides here. So, what is cardiac rehab? It's a program to help improve and maintain a healthy heart after your cardiac event by helping you with the following: understanding what happened to your body, gain control over your health, reduce anxiety and stress, get back to your normal life as quickly as possible, avoid mistakes that others may have made, live longer, enjoy life more, and hopefully experience fewer symptoms. So a few heart facts. How big is the size of your heart? Actually, only slightly larger than the size of your fist. It beats about 100,000 times a day, pumping about 7,500 liters of blood in a healthy heart. And it requires the oxygen-rich blood that pass through the coronary arteries that surround the surface of the heart muscle, as you can see in the diagram. We also have 4 chambers. The upper chambers are the atria, the lower the ventricles. We have the valves that separate these chambers, as well as valves on the 2 main arteries that are leaving the heart. Essentially, it's a 2-sided pump, with the right side having unoxygenated blood that gets passed through the lungs, returns to the left side of the heart, oxygenated, and then is pumped out to the rest of the body. So what is heart disease? It's really any disorder affecting the ability of the heart to function normally. Analogy I like to use is that it's quite similar to your vehicle in many ways, in that we have fuel lines in our car that deliver the necessary gasoline to keep your engine running smoothly. In our heart, we have our coronary arteries that are needed to deliver that oxygen-rich blood to the heart muscle. We also have an electric system in our vehicle that's quite intricate, and more so in our heart, that keeps things synchronized and the heart squeezing and pumping in a regular fashion, as well as a mechanical system that involves those chambers squeezing, the valves opening and closing. Again, similar to our car, in that we have pistons that are moving up and down within the cylinders to keep the engine running smoothly and efficiently. So when we talk about heart disease, oftentimes in our program, more commonly what we see is coronary artery disease, what we call CAD. And what it involves is narrowing or blockage of the arteries that are supplying that necessary and vital blood to the heart muscle. With coronary artery disease, there's a gradual thickening of the arterial walls, making the insides narrow. This is called atherosclerosis. And it's a process in which the inner layers of the artery become thick and irregular due to deposits of fat and other substances called plaque. LDL is part of that, and it's the bad cholesterol. And you'll definitely learn more about this during the dietitian's talk. I always tell my patients that L in the LDL stands for low, as you want that number to be low. It's the lazy stuff, and it's lousy as it causes this plaque to build up within the vessels. So it's a very complex interaction in which this LDL and lipoprotein A gradually change to form fatty streaks and ultimately a plaque with a cover over it. In the first decades of life, atherosclerosis doesn't narrow your arteries or cause pain. For several years, your body can compensate and the arteries can expand in diameter for the narrowing to be maintained until they're finally stretched to their limit and can expand no further. Only after the intra-wall plaque buildups become extensive and the arteries expanded as far as it can go that the internal diameter of the passageway has no choice but to shrink with the further plaque buildup. Large, hardened, visible plaques that narrow your arteries and generate chest pain are not necessarily the most dangerous plaques. The most dangerous are the soft, inflamed plaques that are buried deep inside the artery wall and that can rupture or burst, triggering a heart attack. Stable plaque, as mentioned at the bottom here of that slide, is covered by a thick, tough, fibrous cap and has a small, dry lipid pool at its core, versus an unstable or vulnerable plaque that has a smaller, thin, easily broken cap overlying a soft, large, yolk-like, rich pool at its core with lots of inflammatory cells that make it more likely to rupture. You can see in the diagrams here the heart with the coronary arteries and various blockages, 50% here, 30%. Rule of thumb is that the interventionalists do not normally stent these type of blockages. Usually it's 70% or greater, which is indicated on the other side of the diagram here with a 90 and a 99% blockage. Those would certainly cause someone to be symptomatic. So what happens when these plaques ruptured? Again, as mentioned, you've got this lining that's become more vulnerable to the rich fatty deposits. You've got this plaque with this fibrous coating over top, and it does rupture, spilling these inflammatory cells into the bloodstream and making the blood more prone to clotting, as you can see in this last diagram. And it's the clot formation that ultimately causes the heart attack, as there's no blood flow that is able to get past that obstructive portion with the clot. So how do we treat coronary artery disease? Well, the cornerstone of a healthy heart really is lifestyle management, and that looks at risk factor reduction, managing a healthy diet, exercise, and other factors that we'll discuss further along in the slideshow. And also medical management, which means that you are suddenly started on medicines that you may never have heard of before. Perhaps you were not on any medicines prior to your cardiac event, and now you're having to take 5 or 6 different pills. Having said that, they all serve a purpose, work well together, and are scientifically proven to help reduce your events in the future, and the pharmacist will be doing an in-depth talk on all these medicines. Angioplasty and stenting is another option for coronary artery disease treatment, and I'm going to discuss that in the next slides, as well as bypass surgery. Having said that, some of you may have also had valve surgery. The process for healing is very similar for valve surgery as it is for bypass. Both involve the opening of the chest and exposure of the heart and a lot of healing time. So when we talk about angioplasty and stenting, it's also called, in more technical terms, percutaneous intervention, or PCI. Percutaneous just meaning that there's a needle puncture through the skin to get into the artery, which is usually through the leg, your femoral artery, or oftentimes your wrist, your radial artery, versus an approach with a scalpel that might expose organs or tissue. The first step is a look-see. It's called an angiogram, where a tiny flexible plastic tube is inserted through the artery up to the coronary arteries. An X-ray dye or contrast is used to visualize those arteries and see if there are any narrowings. These arteries are visible on a TV-like monitor. Many of you may have undergone this procedure already. Again, if a significant narrowing is found and it's deemed to be accessible, then the interventional procedure can be performed. The interventional procedure being the angioplasty and stenting. At that time, a balloon catheter with a mounted stent, which is a wire mesh stainless steel tube, is moved to the site of the blockage or narrowing. The balloon is inflated under high pressures and stretched against the artery walls, which pushes the plaque into the arterial wall. It's a snowplow type of effect that reestablishes blood flow. Once that vessel is open, the balloon catheter and guide wire are removed, leaving the stent permanently in place, and it acts much like a scaffolding device. After the procedure, and again, many of you may have gone through this, all the little catheters are removed and pressures applied to prevent any arterial bleeding. And that's what these diagrams are essentially showing, is the plaque. The stent is placed. It is then expanded under high pressure with the balloon, and then everything is removed, just leaving that stent in place to hold the artery open. If they're unable to carry out a PCI or stenting, perhaps due to the location of the narrowing, if it's in a tight bend, or if there's multiple narrowings, sometimes bypass surgery is the better option. We call this coronary artery bypass grafting, or for short, a CABG, just a little bit different than the vegetable one. This also involves an incision to the middle of the chest and cutting of the breastbone or sternum. It involves harvesting of vessels from elsewhere in the body. So commonly they'll take the vein from the leg, which is called your saphenous vein, or sometimes they'll use internal chest arteries. And in other instances, they'll take the wrist artery, known as the radial artery. These vessels then are attached to the blocked artery to try to reroute that blood flow around the blockage or narrowing, as shown in the diagram here. So there's a narrowing, and what's done is they've taken one of the internal chest arteries and attached it to create a new path for the blood to flow freely. Certainly, after bypass surgery, recovery takes much longer than after stents, for the reasons, of course, that breastbone has to heal. Patients describe all kinds of different aches and pains to their chest, their back. They complain of numbness, tingling, itching, burning, and can last anywhere from 6 to 12 months. We do say it takes a minimum of 8 weeks for the breastbone to actually start to heal, though. Oftentimes patients are anxious as well. They may have had some chest pain prior to surgery, angina type pain, heart pain, and now they're having pain again. And it's a differentiation between the two types of pain, be it the angina versus the healing pain after surgery. And it's really quite a variable process for everybody. So what's the difference then between a heart attack and angina? I think we've talked about that, but certainly with a heart attack, it's that complete blockage where there's no blood supply through that vessel. And ultimately what will happen is you will have cell death within 4 to 6 hours. That's why it's really important to get to the hospital as quickly as possible in the event that in case you are having a heart attack, to try to reestablish blood flow and prevent damage to the heart muscle. This diagram here is showing this artery, as you can see, that is blocked and has clot and no blood flow. And again, the higher up it is to the takeoff point, the more significant that heart attack will be as well, simply because it supplies a larger territory of heart muscle. And we always say time is muscle. So again, if you are having symptoms that may lead you to believe that you're having a heart attack, getting to the hospital quickly is very, very important. Angina, on the other hand, is a term that is used when there's narrowing causing discomfort. It's really a warning sign of stress. It's your heart saying, I'm not getting enough oxygen. It can be caused by narrowings, but it can also be caused by something called spasm, when the vessels clamp down and don't allow enough blood flow through. Either way, it can be experienced very, very differently depending on the patient. Some people, have classic angina where they're getting tightness, burning, pressure. Oftentimes, however, in females, it'll be described more as shortness of breath, fatigue, and we see this as well with our diabetic patients, that they don't have the stereotypical type of chest pain. It's usually brought on by exertion or stress because it's related to supply and demand. So if you do have a narrowing and you go out to do some exercise, certainly at that time you may get the angina or chest discomfort because there's a higher demand required through those coronary arteries and you're not getting enough oxygen to the muscle. So how do we manage chest pain or angina? Well, some of you may have been prescribed a nitroglycerin spray. You may have had it prior to your cardiac event, and some of you may still require it if you still have residual or other narrowings that perhaps may not have been fixed. Nitro spray dilates. So in other words, it opens up the arteries, not just the arteries of the heart, however, it opens up all the arteries. So essentially what it does is it allows more blood flow through, but in that process will lower blood pressure. So if you are experiencing chest pain, the first thing you want to do is stop whatever it is you're doing that brought it on. So if you're out walking briskly, find somewhere, sit down, rest. That might be enough to take the chest pain away. If not, you take out your nitro spray, do a test shot just to make sure the pump is primed on it, lift your tongue and do a spray underneath the tongue. If that's not effective, you want to wait a few minutes and repeat it in approximately 5 minutes to a maximum of 2 doses. If that still has not taken your angina, chest pain away, then you would call 911. We urge you not to drive yourself to the hospital. That obviously could be dangerous to yourself and others. So consequences of coronary artery disease. Other possible signs and symptoms can occur, perhaps something that I haven't touched on that may be what you experienced. So be aware of any changes in your symptoms. Contact your healthcare provider if you have any concerns. And again, if symptoms are severe, do not hesitate to call 911 or go to the hospital. I'm going to just briefly talk about the electrical system of the heart. Again, I talked about our hearts being similar to our vehicles. And again, it's a very intricate system, so I'll just take a couple of moments to talk about it. We have 4 chambers in our heart, as I mentioned. This upper right chamber has our primary pacemaker, or SA node, as it's called. And it initiates the impulses in the heart and allows for conduction to occur down the pathways, as they're outlined here, and cause synchronized squeezing and emptying of the heart to get blood through, oxygenated blood through to our bodies. What happens sometimes with a heart attack is these pathways can be interfered with, causing the heart rate to either really slow down or in some cases really speed up, and patients become symptomatic with that. In other words, they may experience palpitations, a racing heart, irregular rhythm, or they may feel very lightheaded and dizzy with the heart rate going either too fast or too slow. If the rhythm is too slow, medications are often given to try to speed things up. And in some cases, a temporary pacemaker or even a permanent pacemaker could be implanted to help regulate the rhythm. With rhythms that are too fast, oftentimes medicines can help to slow things. But if it's a very dangerous, fast rhythm, which can occur in the lower chambers of the heart, in the ventricles, oftentimes electricity needs to be applied to the heart, and what that does is momentarily stun that primary pacemaker, that SA node, the intrinsic pacemaker, and restart and organize the rhythm again. There are some patients that we see that actually have implanted internal cardiac defibrillators, and these devices sense the rhythm, and if need be, they will deliver a small electric shock to the heart and again act in that same way to stun the heart and reset the normal rhythm. So there are lots of things that can go awry with the heart. Probably the most common rhythm we see, and some of you may indeed have this, is something called atrial fibrillation. And atrial fibrillation is an irregular rhythm that initiates up in the atria when that SA node is knocked out completely due to heart attack oftentimes or other issues, and it causes multiple sites to start firing. Gratefully, this center node here acts as a gatekeeper and doesn't allow all those impulses through. What you do end up with, however, is an irregular rhythm that needs to be controlled oftentimes with medicines to keep the rate controlled. So that's all I'm going to say about electrical things. Moving on to heart failure, which is actually not a very nice sounding term, but what we're talking about here with heart failure is heart function issues, mechanical issues, where perhaps someone's had a heart attack, and as I mentioned previously, if there's not good blood flow to the heart muscle, part of that heart muscle can actually die off, and therefore it will not be as snappy and blood will not be squeezed or pumped through as readily. Valvular problems can also cause heart failure, as can high blood pressure over time, high levels of drugs or alcohol, and sometimes we really don't know why people are having this condition, therefore we call it idiopathic. Medications are really, really important for this type of condition. We have heart function clinics throughout Fraser Health where there are trained nurses and cardiologists that will work with you to optimize your medicines, teach you about self-management, and educate you so that you can have the best possible outcomes and avoid symptoms such as the difficulty breathing we often see or shortness of breath due to this condition, the swelling that often occurs in the ankles, feet, legs, sometimes in the tummy, and in severe cases all over. The fatigue, again related to this heart not squeezing properly and the body not getting enough oxygenated blood. Fluid weight gain is another issue. So oftentimes people are placed on water pills to help regulate that. And a lot of information, again, is given over how to manage this condition. So changing topics a little bit here, I'm just going to touch on physical activity for your heart. Bearing in mind that our exercise specialist is going to be doing an in-depth presentation on exercising and the heart after a cardiac event and how to exercise safely. Just want to mention how important exercise is. It increases the blood flow to the heart muscle. It can make your heart muscle stronger. It helps reduce blood pressure. And actually the benefit after exercise can last up to 24 hours. So if you're exercising most days of the week, you're going to have lots of benefit. Helps to lower cholesterol. It helps reduce stress. You get those happy hormones, your endorphins, that we are able to have transmitted and help you sleep better. It can help with weight loss and also help reduce angina and breathlessness and reduce aches and pains from joints and muscles and ultimately, hopefully, help to reduce or prevent more heart problems in the future. Just want to mention physical activity versus exercise, because we often hear this in the program. People saying, well, I'm quite active. You know, I walk to the printer many times a day in my work. That's not exercise. It's good to be physically active, but they are not the same. Exercise is planned, it's structured, it's targeted. It's a time you've set aside to get your heart rate up over in a day. Physical activity, again, are activities of daily life that might be your household tasks, occupational activities, recreational activities, or even those discontinuous walks we take with our little dogs. Oftentimes they're walking us though. So in terms of cardiac rehab options, we do have structured exercise programs offered throughout Fraser Health that include intermediate high-risk programs in the hospital settings, as well as low-risk programs that are usually held in the community. Home exercise programs and virtual cardiac rehab are alternatives to those that are unable to attend traditional classes. And again, the exercise specialist is going to be doing an in-depth presentation and give you more information if you are interested in the exercise programs. But usually, if you have not been referred, you would require a referral to the program. A couple of exercise tips before I leave this is that exercise will make you breathe harder and feel warmer. You should be able to speak during exercise. If you're having any discomfort, carry your nitro needs as directed and reassess your targets as they may be too high. So I'm going to move on to talk about risk factors just for a couple of moments. And having said that, our cardiologist is going to be doing an in-depth presentation on the risk factors. I just want to touch on them briefly. So risk factors are warning signs. They're warning signs and cumulative and can certainly cause cardiovascular disease. The risk factors that you can't change are age and gender, family history, and ethnicity, The ones we can change, of course, are hypertension, diabetes, cholesterol, obesity, smoking, physical inactivity, and stress. So what is it that you would want to change? Again, things that you can work on, including smoking cessation, taking medications properly, healthy eating, lowering cholesterol, reducing blood pressure, getting more active, weight loss, controlling diabetes, and reducing anxiety and stress. Hopefully by viewing all the online presentations, you'll learn more to support the changes that you would want to make. Common roadblocks or barriers that we hear to making change are as follows. I'm worried about how much exercise is safe. Again, the exercise specialist will help you with that. I've dieted before, but I always put the weight back on. I'd rather change everything in one go. Exercise just makes me feel exhausted. I don't know where to begin. I'll never remember everything. I don't have any willpower, or there are just too many things to change. So some thought solutions around that are to make one healthy change at a time. Be confident with your goal and set easy action plans. And when that action plan gets too easy, you want to step it up. Sometimes keeping a journal and documenting your steps, your goals, will help you to see change over time as well. And if you set things easily, very little willpower is actually needed so that you can get to your goal much more easily than you thought. So how do you begin? With goal setting, it's really just pacing yourself, learning and practicing skills, trying to develop confidence and motivation to use those skills, and hopefully feeling empowered by your success. Behavior modifications include changing day-to-day actions and breaking unhealthy habits such as smoking or unhealthy eating. So with goal setting, as an introduction, we see it as a powerful process. It helps you accomplish what's most important to you. It involves more than thinking about the future. It's outcome-based versus a specific behavior, and helps you look at what you want to change over the next 3 to 12 months. So hopefully you're all starting to think around what it is you might want to change, and what we use is an acronym and something called SMART goals. S for specific, M for measurable, A for attainable, R for relevant, and T for time-bound. And we encourage you to develop an action plan starting with those small baby steps, asking yourself what, how much, when, how often, the level of importance to you, as well as the level of confidence and motivation on a scale of 1 to 10. And if that number is low, below 7 even, you might want to look at picking another goal that you can work on that you may feel more confident in achieving. So a couple of examples I've got here. One is the story about Edith. And Edith had coronary artery bypass grafts 4 weeks ago. And her goal is to start light gardening again. She really enjoys her garden. And her SMART goal, as she set for herself, is just to go out into the garden and plant flowers for 20 minutes each day. And she's found that that's neither too hard or too easy for her, and about 5 out of 10 for effort. So she goes out into her yard, and after 20 minutes of planting flowers and doing some light gardening, she stops and puts her tools away. She knows she could do more, and she'd actually like to, and it's a bit frustrating to have to stop now, but she sticks to her action plan. She goes inside, has a great rest of the day. The next day, out she goes and looks forward to doing some more gardening. She does just the 20 minutes as she planned, and she continues to do that over the next week. She's starting to feel stronger, and the work is getting easier. After a week, Edith's goal of 20 minutes is now too easy, so she decides to update her action plan and bump it up to 30 minutes. She does this progressively, feeling more confident, and over the next 6 months, she's able to review her goals and pace herself and set new targets, until ultimately and finally she's able to work all day in the garden again without any problems. So again, she set nice baby steps to achieve her ultimate goal of working in the garden. On the other flip side of that, we have Robert. And Robert's goal setting story is something that we have seen as well here in cardiac rehab that we call the overactivity rest trap. Robert loved his garden, much like Edith, but he's had his heart attack, and since his heart attack, the garden's become a mess. So he doesn't really have a plan, but he decides he needs to get out there and do as much as he can. So out into the yard he goes, again with no plan, and after half an hour, he's tired, but he keeps pushing, using the old motto, no pain, no gain. He continues to work for an hour, and at that point, he just simply cannot go on. Into the house he goes, into the recliner, and over the next few days, he's too tired to do anything but rest. 3 days later, he's finally feeling a little bit better, so he decides to go out and have another go at things. But this time, after only 15 minutes, he has to stop. And he says to himself, it's no good. I can't go on. I've done even less this time. A week later now, he's waited. Robert's finally feeling a bit better, but it's taken him a full week to recover. The garden's too much for me, he says. I'm not going out there again. After 6 months, he's still not been able to get out and decides it's his heart. It's getting weaker and weaker all the time, and he's going to have to get someone to maintain the garden for him. Unfortunately for Robert, the benefits of the exercise were lost, as you can see, and Robert was less fit than before. Perhaps if he'd used goal setting the same way as Edith, he would have become stronger and not weaker. So again, we urge you to set SMART goals. And here's some examples of some SMART goals. This one we hear oftentimes in our cardiac rehab program. I would like to lose weight. So to make that into a SMART goal, you might want to change it to something like this. I would like to lose 12 pounds in 4 months by walking a half an hour a day, cutting out my afternoon snack, and those simple changes would add up to 12 pounds in 4 months, possibly even more, a healthy weight loss being 1 to 2 pounds a week. And again, the dietitian can help guide your dietary changes so that they are healthy and will work to your benefit. Another example, people say I would like to be fit, but what does that mean to you? How can you break it down further? Instead, you could try, I would like to improve my cardiovascular fitness such that I can climb 3 flights of stairs without stopping. And again, setting a date for that goal and a plan around it. And it might be as simple as you living up on the 3rd floor of your home and you can't get to the condo without taking the elevator and wanting to do so. So maybe you would start with 4 or 5 steps, whatever you can do easily, come back down initially, take the elevator up to the 3rd floor, keep adding steps on until you can get to that 1st floor, and then taking the elevator from there and continually adding on to your action plan until you can finally do the 3 flights of stairs comfortably. Third example here, and I hear this one all the time as well, is I would like to be healthy. And instead, you might want to break it down. Perhaps your blood pressure is well above target. So here, what you could do is look at improving your blood pressure to be less than 130/80, which would be a healthy blood pressure, by a date and how you might get there. In other words, you might start walking for 30 minutes a day, reducing your salt consumption, and maybe taking your medications as planned. So these are examples, and again, we urge you to come up with goals that have meaning for you. Before I finish and before I close, just a little bit of information in my presentation in around anxiety and depression. We recognize it's really common for people to experience negative feelings after a heart event. And it's not just the person that's had the event that might suffer, it's often the family that suffers as well, because they're scared that you've had your heart event. They may feel even some anger themselves or guilt. Again, many different emotions that are associated with this. Anxiety and depression, we know, are also associated with a low rate of returning to work, lifestyle changes, compliance, quality of life, and sometimes readmission to hospital. What is anxiety? It's that raise of adrenaline level, which may cause a feeling of constant or intermittent tension, difficulty sleeping, restlessness, inability to concentrate. It may also increase feelings of anger or make you feel more distant. It is unpleasant, however, it's not dangerous. And depression, on the other side, is that low mood that lasts longer than usual. It's usually a feeling of overwhelming sadness, and people feel stuck in that place, usually for 2 weeks or longer. What we urge you to do if you think you may be experiencing anxiety or depression is please refer to the lecture entitled Cardiac Event in the Family, which examines emotional adjustments after a heart event. So that concludes the introductory presentation. I want to thank you for taking the time to view this session and for participating in the Fraser Health online cardiac rehab education program. And we hope that you view all sessions and find them helpful in your recovery. Thank you.